The question of the day, does IVF hurt? Yes, it hurts bad. And the reason for that is the injections you have to give yourself, the actual procedure of having your eggs sucked out of you. You have to have them planted back in. You have to have your blood drawn every day or every other day for the 2 weeks preceding that. The actual chemicals they give you make your ovaries get really painful. It depends how bad it is, because then sometimes you can't even do the IVF. Now you have to have at least 3 to 6 artificial inseminations, which are IUI, leading up to the IVF for your insurance to cover it in most cases. So what you're doing is you're pumping yourself full of drugs, giving yourself injections, and the time comes for you to go in, and you have to give yourself the Avidril or whatever it is to stimulate your hormones to release eggs. And they go in and they give you a it's not general anesthesia, it's an IV anesthesia, which they stick it in your hand. Now, having the IV stuck in your hand is pretty painful. They give you the option of having a local anesthetic, but unfortunately that's also injected. So you get a needle before you get another needle to make the other needle hurt less. Next time I would just take the needle in the hand versus the shot and the needle in the hand, because you're going to go under pretty soon anyway, and you're going to wake up in horrible pain, and they're going to give you painkillers for it. Now, you won't remember anything. You'll just be in a room with your legs in the air, and it'll be like, good night, and then you'll wake up, and it'll feel like somebody kicked you as hard as they could in both sides of your stomach. It's like a dull, aching pain and sharp stabbing pain, because they puncture the wall of the vagina. They don't just go up there and gently remove them. They stick a needle and suck it out with a foot pump. And so then they put them in, and they may only get 5 eggs. They might get 19 eggs. But most of those don't fertilize. Or maybe they will. Or maybe they fertilize, but they don't continue to develop into blastocyst stage. You have it done on day 3, you go back, you're going to be in horrific pain when they do it again. Day 5, you won't be in as much pain because it lasts about a week, but it's still very uncomfortable. And it hurts, and they're lying if they say it doesn't hurt. Of course, there's complications with it, and I wouldn't recommend doing it, having your ovaries continually punctured and keep harvesting eggs. It just can't be good. And if you're using someone else's eggs, if you're in your 40s, you have to remember that's an adoption. Those children have a different family history, a medical history. They're not going to look like you. If you want to have a baby, I would recommend foster parenting instead of going through all this, because of the risk to your own health, and it's just generally not the best procedure. There's a very high risk of twins, because especially when you're older and they have to hatch your eggs, which they didn't have to do with mine, but women who are in their 40s, they have to take a laser beam and break it so that it goes and it could split. It could go into identical twins. Even if you put one in, you might end up with 2. So it's something to consider. So to answer the original question, yes, all the injections, the pain of having it done, the pain of taking the medications, the pain of you have to deal with a miscarriage, should it happen, it's still the same risk, and the risk of multiples. And it's not like, oh boy, I'm going to have 3 babies. It's going to be like, oh boy, I might have 2 babies that are normal and 1 baby that's really messed up. So we're not made to carry so many children at one time. And it's always wise to get pregnant naturally and wait another year if you have to, than to go through a medical procedure, because the long-term risks aren't really known. Thanks.